Good morning, everyone. Thank you so much for your patience. One of these wacky Zoom situations. We're going to be talking about reducing stress and building effective communication in CSE meetings using strategies from DBT. So briefly, my background, I have a doctorate in school psychology. I've worked in schools before getting my doctorate, and during my training, I've worked in schools. So I've accumulated experiences providing consultation to teachers, school counseling, and I've attended many CSE meetings and have helped in the developmentation and implementation of IEP and 504 plans. So before joining Behavioral Psych Studio, which is where I am a staff psychologist, we are a small private practice in Manhattan, and we provide evidence-based treatments, including cognitive and dialectical behavior therapy. Prior to joining, I was working at Cognitive and Behavioral Consultants, where I trained school administrators, teachers in school-based DBT and supported schools in implementing those programs. And currently I provide comprehensive DBT, which means that I lead skills group for families, including both teens and adolescents, as well as adults. So I'm excited to combine these two passions of mine, school psychology and DBT, and share how I think elements of DBT can be helpful in supporting all stakeholders in these high stakes, stressful situations. So I'm going to try to focus my examples as we go through the skills on things that are relevant to CSE meetings, though some may be more relevant to experiences in the school environment overall. Okay, can you go to the next one? Thank you. Okay, so again, welcome. Here we've got this fun little graphic that's got a lot of the buzzwords you'll hear me saying over and over today: emotions, interpersonal, mindfulness. We're going to talk a lot about mindfulness. Oop, you just went there. Skills, right? Validation. Okay, next slide. Okay, so objectives for today. I'm going to be telling you a little bit about the theory behind dialectical behavior therapy, as well as skills for improving mindfulness, improving communication, and coping with intense emotions. Oh, okay, someone wants me to speaks. I'm sorry, I did not see that. Okay, so DBT was created by Dr. Marsha Linehan in the 70s at the University of Washington. It is a behavioral treatment designed to treat chronic suicidality and borderline personality disorder and concurrent behaviors for adults. So this treatment was later adapted to work with many other populations experiencing different problems, such as depression, anxiety, behavioral problems, and I'm going to tell you a little bit about those adaptations shortly. Oh, we can see a Google window. There we go. Okay. So behaviorism is a subfield of psychology that works on changing individuals' quote psychology, therefore, emotions and thoughts, in large part by changing behaviors. So emotions, thoughts, and behaviors are all interconnected and influence each other, right? For example, if I think I'm going to bob a job interview, my anxiety goes up and I might stutter or blank out, etc. So within behaviorism, we focus on controlling one's behaviors to influence the other two, being emotions and thoughts. The focus is on helping people to learn and use new skills so that they can develop what we call a life worth living. And we're going to talk about those different skills domains shortly. Okay, next slide. So these are some of the adaptations, and I have trained with some of these people. So I used to be supervised by Dr. Alec Miller. He and Dr. Jill Rathis created DBT-A, which is DBT for adolescents. Francesca Paraplechikova developed DBT for children. And then there's the DBT STEPS program. Those of you working in schools may be familiar. But this is an adaptation so that these skills can be taught within like health classes, PE, to the general population. And then RODBT was created for over-controlled behaviors, things like eating disorders or restrictive eating. And Dr. Alan Frizzetti developed, oh, someone's asking what dialectics are. I'm going to explain that in a second, I promise. So Yes, Alan Frazzetti created a adaptation for families and couples, which is really great. Okay, can we go to the next slide? Okay, so these are the target areas of DBT. We also call them the 5 problem areas. At any rate, I just wanted to show the different areas that typically people coming to DBT are presenting with, and then the corresponding skills we use to address those problems. So first is self-dysregulation, which can involve, we call sometimes confusion around self. So confusion about your own values, your goals, difficulty focusing in the moment, difficulty knowing why you're experiencing a certain emotion. For that, we have mindfulness skills. Mindfulness is really at the core of DBT because we need to be aware in the present moment in order to even select another skill to use. Then there's emotion dysregulation, which for people in this treatment is generally the core problem that brings them in. For that, we teach emotion regulation skills to maintain like a steady baseline and reduce mood dependent behavior, such as, I'm anxious, so I'm going to avoid, I'm sad, so I'm going to withdraw, decreasing that. We are not going to focus on emotion regulation skills today. We are going to emphasize mindfulness, distress tolerance, and interpersonal effectiveness, and a little bit of middle path. So to target impulsivity, we have those mindfulness skills I already mentioned, as well as distress tolerance skills. We will talk about those. For interpersonal problems, we work on interpersonal effectiveness skills. The middle path skills in that bottom row are taught to adults and teens and families, everybody. It's just that in adolescent DBT, which is the way that I was trained, we draw that out into much more content, but this includes the concept of dialectics, which I will explain shortly. Can we go to the next slide? Really quick, Helen, could you reclaim the host, because I'm letting people in while I'm talking? Thank you so much. Okay, so here you can see we've got this seesaw. This is the D in DBT, is dialectics. So this is not a word that we hear often day to day. A dialectic is 2 opposing views that can be true at the same time. So I'll give an example. In DBT, we talk about these, DBT assumptions, unproved beliefs that we hold to be true of ourselves as DBT providers and all of our clients. And, I try to extend this to everyone in the world, but essentially we have this belief that people are doing the best they can. Everybody is doing the best they can, given their current emotional pain, the skills they have available, and the life circumstances they're enduring. People are doing the best they can. And at the same time, people need to do better, try harder, be more motivated to change, right? So this forms this dialectic of acceptance. You're doing the best you can, and you need to do better. And I use the word and because when we use the word but, it tends to get us into this rigid all or nothing place, and we're trying to decrease that black and white thinking. This helps us to decrease conflict and increase perspective taking. If I can see the other person's side of a situation, and there usually almost always are 2 ways to look at a situation. When we're able to do that, we can decrease our own emotional intensity. Another one of those DBT assumptions I mentioned is that change is the only constant, right? Reality is not static, as it says here. Life circumstances always evolving. So this helps us to engage in some more flexible thinking. Any questions so far? I can see them in the chat, so feel free to jump in. Okay, let's go to the next slide. So CSE meetings are stressful. That's probably a massive understatement. It's a lot to take in at once. I totally get that. It is. We're going to get into some more concrete skills that I think will be easier. And you all have these slides, which Helen will distribute. So CSE meetings are stressful, right? There's just no doubt about it. Concerns about student performance, all stakeholders at times, right? Not feeling supported by others. And we all have our own life stressors and mental health challenges. Okay, next slide. Is there anything anyone wants to add for context? Feel free to write it in the chat, like other circumstances that create a lot of stress and high emotions. Feel free to type them in. It'll actually help me to tailor some examples I'm using a little later on. Okay, so we're going to dive right into skills. We're going to start with mindfulness. As I mentioned, that's at the core of this treatment. And then we're going to talk about interpersonal effectiveness skills and distress tolerance skills. And I'll explain more about what those are as we go through. Okay, next slide. Okay, so let's talk a little bit about mindfulness. I want to hear what you know about mindfulness. Mindfulness has become kind of this buzzword. There's all these apps now. Everyone's doing mindfulness. So I want to know what mindfulness means to you. Can I get some thoughts in the chat? Could be one word. I just want to know where everyone is at. Okay, being now in the present moment, aware of yourself. These are amazing. Grounding in the present moment. Wonderful. Staying in the moment. Yes, 100%. These are all right on the money. Observe the moment with no judgment. I like that. Looking at what's right in front of us. Amazing. So those are all it, right? So I like to read this one definition when I start teaching mindfulness. And this is from John Kabat-Zinn, who is a real leader in mindfulness and created mindfulness-based stress reduction. And he says, mindfulness is the awareness that arises from paying attention on purpose in the present moment and non-judgmentally. So I think that all of you included an element of that in your responses. So thank you. This is really about being in control of your mind rather than letting your mind control you. So being aware in the present moment, right, of our thoughts, our emotions, our physiological sensations without judgments, without trying to change it. This takes a lot of work. So it's like training a muscle, it's constant practice. So when we use mindfulness skills, it gives us more choices and more control over our behavior, right? Because we can slow down, notice the emotions, thoughts, urges, right? We can become more self-aware, and it can help us choose a behavior more thoughtfully rather than acting impulsively, potentially making the situation worse. Mindfulness helps to reduce our emotional suffering. Mindfulness helps to reduce our emotional suffering, help us make important decisions, right? Balancing emotion and logic, which we'll talk more about in a moment, helps us focus our attention and make us more effective and productive. It helps us increase compassion for others and lessens even physical pain, tension, stress. There's evidence to support that mindfulness interventions are effective for problems like chronic pain. So before we move on to our first mindfulness skill, I want you to think about, those answers you typed into the chat, right? That awareness, paying attention in the present moment. And I want us to do a quick exercise that I'm hoping will be helpful. It's not on the slide. So this is what I call a 5, 4, 3, 2, 1. And it can be used as a grounding exercise. And also which is a component of mindfulness. So I want you to, we're going to just take a mindful minute, and I want you to notice 5 things that you can see, 4 things that you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. If that's too much to remember, it's sight, hearing, touch, smell, taste. If that's too much to remember, we'll take a mindful minute and just try to notice what's around you without judgment, without trying to change it. We're just going to take a moment. Okay. What did you notice? Let me know in the chat. What did you notice by staying in the present moment, using your five senses? Okay, wonderful. Noticed feeling quiet and peaceful. Oh, shoulders relaxed. Okay. Noticing the environment that surrounds you, birds chirping. That was one of my observations as well. Totally in your own little world. I love that. Just really tuning into what's going on around yourself. Wonderful. Thank you. So this is one that there's a buzz in your headphones. Okay, great. So this is an exercise that we can do anytime, anywhere, right? We can always take a mindful minute to become present in the moment if we need to increase that awareness, decrease emotional intensity, etc. Okay, can we get the next slide, please? Wonderful. So the last component of mindfulness we will discuss today is this concept of mindfulness and the three states of mind, which is also sometimes described as the skill of wise mind. So the idea here is that at any time in the day, in our life, we are in one of these emotional states. And they are all helpful or unhelpful in different contexts or situations. And by increasing our awareness, we can be most effective. So let's start all the way on the left with reasonable mind. These are in different colors for a specific reason, right? So I've got reasonable mind in like those cool blue colors because it's when we are in reasonable mind, as it says, we are only taking reason into account. This is where we are cool, cold, logical, linear, very focused on cause and effect, and dismissive of emotions, right? We're task-oriented, we're solving problems. This can be great, right? This can be effective when I'm in a situation where I don't really have any emotions going on, right? So it could be that I'm, writing my progress notes at the end of the day from my sessions, or I'm in the supermarket, I've already made my shopping list on my phone and I'm just going through checking off the things as I pull them from the shelves. It's pretty automatic. It doesn't take a lot of emotion. So this can be helpful, for people who aren't anxious about finances like myself. I've heard people say like doing budgeting or paying bills or doing taxes, balancing a checkbook are examples of reasonable mind. Again, if that doesn't terrify you. Then emotion mind is all the way on the other side. Oh, I wanted to say one more thing about reasonable mind. So sometimes reasonable mind is very helpful, right? In terms of those tasks I just mentioned. However, since it is unemotional, this is not a space where we're going to be able to work on connecting with others, right? We're going to be in a space of just focusing on tasks, right? And numbers. So we're not tuning into relationships. We're not going to be able to validate others. So that is one consequence. Then in emotional mind, right, you can see it's like red hot. Anxiety feels like an overlap, unwise or unrealistic. Okay, no, that is interestingly. Thank you for writing that. I'll come back to that. So emotion mind is red hot, right? This is when we are being completely fueled by emotions. It's unpleasant, impulsive. We're not thinking, right? We're dismissive of logic. So, all of these have some benefit, right? Emotion mind is great when we are in like a safe situation and we want to fully experience emotions that are positive, right? Like going to a friend's wedding or going to your favorite concert or eating your favorite ice cream. It's okay to be in emotion mind and just savor all of those good emotions, those positive emotions. The ones listed are negative emotions. You're absolutely right. Well, impulsive can be, I guess, can be good if it's towards something effective. But thank you for that, Patricia. Yeah, it's purely driven by emotions, and the reason they're all negative emotions is because this generally doesn't work out well for us. it can lead to some unproductive, destructive behaviors, right? When we are purely driven by emotion. And then in the synthesis, we've got wise mind, right in that middle. It's a synthesis of reasonable and emotional minds. So when we're in wise mind, we are taking into account both the facts and the logic, as well as our feelings. So it's sort of this inner knowledge, inner wisdom, inner goodness that everybody has. Sometimes it's hard to access. And we're going to be talking about some skills to get us out of emotion mind and into wise mind. Reasonable mind has a positive as well. Oh, yeah. Okay, I could see that. So if we're thinking about something like anxiety, and that's driving us completely, that's probably going to put us in emotion mind, right? When we're anxious, typically the urge is to escape. So we might be in emotion mind. Now, if we can pull some of the reason in and look at the facts of the situation and maybe remind ourselves that we can handle the negative emotions and things will be all right, we can move ourselves into wise mind. I've worked with a lot of parents on skills to hold off on sending angry emails impulsively. And my rule of thumb is we do not send emails or texts, for that matter, in emotion mind. We wait until we can access wise mind. It's generally not so urgent that it can't wait for a few moments to try to access wise mind. Another example I would give of the 3 states of mind, I have a colleague who has 2 dogs that she loves dearly. And we've talked about what would happen if she passed by a shelter, right? And she saw all those cute dogs inside. In emotion mind, she would bring them all home, no question. In reasonable mind, she would leave with none. And in wise mind, maybe there's like 1 puppy, or she's offering to foster another puppy for a month or 2. Right? So we can take any behavior and look at how it would look in each of those states of mind. I'm going to be referencing wise mind a bit. Okay, let's keep going. Thank you. So the second domain rather of skills we're going to discuss are the interpersonal effectiveness skills. Now, in any interpersonal interaction, we can prioritize one of 3 things. Now, sometimes we can have one that's a close second, but when we try to prioritize all 3, we're generally not effective. So the first one is obtaining objectives. So essentially getting what we want or saying no to someone effectively. And for that, we have Dear Man, which we'll go over next. For building and maintaining relationships, we have the give skill. And for maintaining self-respect, we use the fast skill. I'm just going to run through what fast is now, because it's not going to be as relevant to sort of the high stakes CSE situations. This is an acronym. There are a ton of acronyms in DBT. So FAST stands for being fair, no apologies, stick to your values, and be truthful. This is a really important one for teens in terms of tolerating peer pressure, and definitely a valuable skill, just not one that we have the time for today. Okay, can we go to the next slide? Wonderful. So the wonderful thing about Dear Man is it provides us with this formula to help us ask someone for something or say no to something in a way that is going to increase our chances of getting what we want. Does anyone have a situation that they've encountered that they would like to share relevant to like the CSE environment or any communication between stakeholders? I can use an example. I've got that I like to make this relevant. And I like to make this relevant. I'll see if anyone types something in, but I'll get started explaining. So the DEAR tells us what we need to do, like exactly what we need to say verbally. And the MAN are sort of the spirit of how we want to go about those first 4. This will make sense as we talk through. Again, this is in your PDF slides that you will get after this, and I highly recommend reviewing this. So first, we describe the situation, right? We're talking to someone, we describe what's going on, just the indisputable facts without any judgments, right? So I often, if anyone has an example, again, feel free to jump in. I'm going to use the example that I come across a lot with families of curfews. So, right, I've noticed you're coming home, lately, if it's a parent, I've noticed that you are coming home at 12 and we had agreed on 10 p.m. that you'd be home, right? That's an indisputable fact, right? We need to make sure that others are clear on the facts, because if we're not starting from the same point, then that's going to create problems down the road. Then we express our emotion. We use some sort of an I statement, right? I feel, I would like, it's important to me that, right? It really is effective to let others know how we're feeling and can sort of motivate them to help us, right? We want to stay away from should statements. You should be doing this, right? Because we may be putting an unrealistic expectation on someone. So when you come home late, I worry about your safety, right? One sentence. Then our assert, the assert is the ask, right? We want to be very clear, like so behaviorally specific that we can, myself and the person I'm asking can both visualize in their mind, right? So I would like you to come home by your curfew, right? Very clear. It's not a threat. If you're not home, I'm taking your iPad. But it's a very clear request and it's not phrased as a question. Then we have to reward or reinforce people ahead of time by explaining the positive benefits of them getting what we want, right? Like, how is this going to be good for them? Because we need to motivate people to help us. So in the example I've been going with, that might be like, it could just be, I'd be really grateful, but it also might be, I'd be able to trust you more and then give you more privileges if you're able to do this. So those are the 4 things we say. This can and often is most effective if we can limit to 4 sentences. Keep it short and sweet. Making it longer doesn't generally help us to get what we want. Let's go into the second set, those man skills. So being mindful, this is a really tough one for some people. So we have to be a broken record, right? Others may try to get us off track. In the example I've been going with, like last month I was coming home early all the time, or, well, you don't let me go, you don't let me go to XYZ, I should be able to, right? People are going to make attacks that are going to try to get us off track. And it's our goal to be mindful and keep coming back to our assertion over and over, right? So they may bring up valid points. And so this is about saying, I hear you. And right now I'm asking for this. Like, we can talk about that later. So it's about just constantly coming back when you're getting a little derailed. Appearing confident, right? It is what it sounds like, right? Appear confident. You don't have to feel it. You can fake it if you need to. But maintaining eye contact, a firm, steady tone of voice, right? Neutral facial expressions, stand tall. And then we have to negotiate sometimes, not always. We need to be willing to give in order to get. We can ask for the other person's input, right? It's better to get some of what you want than nothing at all, as it says, right? We need to know when to agree to disagree and just walk away. Or find a way to meet in the middle. And this sort of tunes into that idea of a dialectic, right? Like, where can we compromise in the middle, get unstuck from 2 sides? Does anyone have any questions about Dear Man, how to use it, any of the components? One thing I recommend is, or a few recommendations I have, is practicing this first. An example in the skilled music girl personnel, you don't want to provide it accommodation to a student, and how an advocate or parent could use this dialogue with CSE staff. How an advocate or parent. Okay, so, it would really work the same way. Describe, so without knowing the situation, I would state the facts of whatever the accommodation is that the child does not have, or what the current accommodations are, right now this child has, alternate location for tests and 50% extra time, whatever it is, and this has been in place for 2 years. Whatever the current accommodation is that you want to change, or whatever facts are needed, right? Express. If you're trying to get additional services, I imagine this is because there's some concern, right? So I would use an I statement about potentially feeling anxious, right? I'm doing a lot of interpretations about what your emotions might be, right? Like, I feel anxious. I feel that this is not enough. There is not enough in place to support the student. Assert whatever accommodation you're asking for. I am requesting XYZ. I would like XYZ. And reinforce what's in it for them. The student performing better, right? And that's what everyone generally wants. It can be hard to see eye to eye, but generally everyone wants the student to be successful. That's what I would rely on for a reinforce. I hope that makes sense. So I would recommend, as I said, practicing this in a low stakes environment. Yes, I do think parents would benefit, but this is also something we can practice, right? Like low stakes environment. Practice this at Starbucks when they make your drink with whole milk instead of almond milk. And when you're getting ready for a higher stakes, dear man, I would recommend writing it out and practicing it. I tell my students and adults, like, there is absolutely no shame in writing this out and having a piece of paper or your phone in front of you. If that's what's going to help you to be effective, then do it. Do what works. Okay, let's move on. Okay, so we're not going to spend so much time on this skill, which is called give, because we're going to spend a lot of time on the V in give, which is validation. So again, for building and maintaining relationships, we need to use our give skills. So we need to be gentle, act interested, validate, and have an easy manner, right? I think interested and validate, I'm not going to talk about now because we're going to spend more time on that. But acting interested, I think we all know what that means, right? It's sitting up, being awake, looking at the other person, nodding along, and maintaining eye contact, right? Not like heavy sighing or on your phone, right? Acting interested in an easy manner. We just want to be mindful of our tone of voice, our facial expressions, those nonverbals. Okay, let's go to the next slide. I'm going to try to move quickly because I'm sad that we got a late start. So the skill of validation is really essential because validation improves relationships, but it also decreases our own reactivity. Our own emotional intensity can decrease, right? It helps us to accurately label emotions so that people can understand what we are feeling. It shows to others that we are listening, we understand, we're not judging, we care about the relationship, right? And connects to this idea that's dialectical of we can disagree without having a big conflict, right? I don't have to agree with you, and I can see your point of view. We don't have to do this with increased conflict. Right? We are always balancing acceptance and change. And so this strategy definitely falls on the acceptance side, right? Because we're meeting someone where we're at, we're listening, right? We're not really trying to change the situation. And this does allow for more change, right? We can validate while asking for what we want, getting our needs met, right? Even after validating. So this does lay a foundation for change. Okay, next slide. Okay, things that get in the way of validating, at least in my experience. So some people have like myths about validation that I'm going to debunk in the next few minutes. That validation condones behavior, it praises unwanted behavior, or believing that validation is agreement, which is absolutely not. Sometimes our own emotions are too intense, right? Like we may need to use skills to calm ourselves down before we can validate someone else. You may not have the skills. Sometimes we confuse relating with validation, like, oh, that happened to me too, right? When I was your age, XYZ, which is not generally effective. When we don't get validation in return, we can get very discouraged. And validation can increase emotional arousal for some kids. Some kids get fueled up by it. Like once they hear that their emotions make sense, it amps them up more. So just something to be mindful of. And if invalidation is inaccurate, it can backfire. So I'm going to explain how that can occur shortly. Can we get the next slide? Thank you. So invalidation communicates, whether it's intentional or not, words or actions that the other person's emotions, thoughts, actions do not make sense, right? Are manipulative, wrong, not worthy of our time, right? So I always start with what validation is not. Can we go to the next slide? Okay, so validation communicates to another person that their emotions, thoughts, behaviors make sense in the situation, right? Self-validation is just communicating that to ourselves. So give me one moment. Okay. Validation is really about finding the kernel of truth, right? Like one thing that's valid in what the person is saying. And we'll talk more about what that means. Let's go to the next slide. So again, before we get into like the nitty gritty of how to validate, I need to emphasize these. Validation is not agreement, right? I can see that someone is upset without agreeing with the reason for their being upset. For example, with a student, if one of my teens comes into session, they're saying like, I'm so upset. I got a C on like my math test. It then comes out like after that, like, well, I didn't have time to study until last night. Right now, I know that studying just the night before an exam is not going to be effective, right? So I don't agree with that strategy and I don't approve of it. And at the same time, and I'm not going to encourage it in the future, at the same time, I can validate that they are upset because they did not get the outcome that they wanted, right? Things did not work out the way they expected. So I can still lean in with validation and say, yeah, that sucks. Of course you're disappointed. Like this isn't what you were expecting. So I just like to make that super, super clear. We do not need to agree. Validation is not praise. It's not cheering someone on, etc. Okay. Let's quickly talk about some ways to validate. So the first way we can validate is just staying awake, paying attention, nodding, making eye contact, being mindful of our nonverbals. These are in order of sort of the nuance, I guess would be the word. So, past just literally being awake and, using verbal and nonverbal, we can reflect feelings back without judgment. So this means we are literally like parroting or summarizing what the person's saying, right? A student tells me they're upset. Yes, I hear that you're really upset or bummed out, whatever, right? I'm just reflecting back what they're saying so they know that I can hear them. And I take what they're saying seriously. Then number 3, this is where I was saying if we miss the mark, we can make things worse. So number 3, observe feelings in another person, is basically like mind reading. Now, if we get the emotion right, this is super effective. If we get it wrong, it might backfire, right? So I can observe that another person is, their eyes are welling up, their like facial expression looks like sad, they're sort of withdrawn, and I can have the thought that they're feeling quite upset or sad, right? And so I can use that data to say, hey, it looks like you might be really upset right now. Is there anything I can help you with? We want to then show tolerance. So what makes sense, right? So we can do this in 2 ways. We can normalize, and then we can look at the person's history. When we normalize, we're saying like, who wouldn't feel that way in the situation you're in? Anyone in your situation would feel that way, right? As I was saying before, like who wouldn't feel upset about getting a C? I think that most people would. And then in terms of history, let's say I know that this student like struggles with executive functioning and planning ahead for exams. I can say, but I know they've been working on it. I might say, this is so tough. This is such a tough grade for you to get. I know you're trying to work on planning ahead, and it's been really difficult for you. And then the last way we can respond is just showing we may know our validation is an agreement, does not mean the other is trying to perceive validation as such. Yes, with some people, you have to be very careful how you validate, and using sort of the listening numbers 1 and 2 might be the most effective. If you know that someone is reactive and may complain that you don't validate them, they want you to. Yes, I agree. Validation is really, and I'm glad you mentioned this in the chat, validation is in the eye of the beholder. There's nothing that is inherently validating to everyone. I mean, maybe like eye contact and nonverbals, but there's no one statement that everyone is going to find validating. So that last way is just sort of being like radically genuine, right? If I see someone's crying, I give them a tissue. It might just be me being super transparent and saying, you know, what do you need right now? Do you need a vent? You need some validation, or do you need help solving a problem? Because if I jump to problem solving, which is a way that we invalidate often, by just trying to fix the situation and not actually taking the time to hear, I might be invalidating them further. So by asking that question, I'm showing that I care about this person. I'm treating them as an equal, and I want to help them in the most effective way possible. We're not going to talk about self-validation. It really takes most of those and just applies them to ourselves. Can we get the next slide, please? Okay. Very quick, right? We're always balancing acceptance and change. So we're taking a quick peek at the distress tolerance skills. These are focused on either crisis survival, so like the change side, or reality acceptance, right? Accepting pain or trying to get through the situation without making it worse. Those are the two goals. The main goal of distress tolerance is to get through a situation without making it worse. Okay, let's go to the next slide. Okay, so we're going to go through a few distress tolerance skills in these last few minutes. The first one I like to teach is called the stop skill. So anytime we are having an urge to do something destructive, we can use this skill. You can imagine a stop sign in your head, right? So first step is stop, freeze. I tell kids this is like freeze dance. Don't move a muscle, right? Your emotions are trying to make you act without thinking, but we're not going to let them. We're going to stay in control. Then we take a step back, right? Get unstuck from what's going on. Let it go. Take a breath, right? We're going to stay in control. We're not going to let those feelings push us over the edge and make us be impulsive. Then we observe, and observing is a mindfulness skill. We actually practiced this when we did the 5, 4, 3, 2, 1. So we need to use that sort of a skill. Do I find men try to problem solve more? That is a good question. I don't know if it's gender specific. I don't have an answer for you on that. Okay. So observing inside and outside of ourselves. What is the situation? What are our thoughts and feelings? What are others saying or doing? And then we can proceed mindfully, right? Get into wise mind, right? We're going to act with awareness, right? Think about, what are my goals? What do I need to get from the situation? What will make it better or worse? Okay. Let's move on to the next one. So I do want to save some time for questions, so I'm going to just go through elements that I think are relevant. So the idea behind the tip skills is that this is for when we're like in that red zone and we need to reduce emotional arousal. And we might be in a place where it feels like no skills will work, or you can't even think of skills to use. You can use the temperature skill or intense exercise, which I'm not going to explain right now because they're not skills that are feasible to use in the middle of a meeting, but highly, highly effective. Paced breathing, which ordinarily I would have us practice, but essentially this is the process of Inhaling and exhaling slowly and making sure that you are breathing out longer than you're breathing in. And then we have paired muscle relaxation. That means we go through the body and tense a muscle group while inhaling. And then we exhale and release that muscle group. Notice how relaxed it feels. And this is because our muscles actually relax more when we tense them first versus if I said, okay, just relax and you like make your body dead weight. So that's the reason that we do those, to bring down the emotional intensity, at least buy ourselves some time, prevent ourselves from making it worse. Okay, we've got the improved skills. The idea behind the improved skills, which again, another distress tolerance skill, are for options in the moment in a public place where you can't leave and you don't have access to anything, right? Like you don't have access to ice water, you can't do some push-ups, right? You're in the middle of a meeting. I'm going to just go through a few of them. Imagery, right? You can imagine your emotions just sort of draining out of your body. Meaning making, I really like. I like the idea of trying to, when we get into a really intense situation, like what meaning can I make of this? Is this an opportunity for me to practice skills? We can look inward to our own wise mind, and we can try to encourage ourselves, right? You've got this. This meeting ends in 45 minutes. You can do anything for that long, right? Stay in control, whatever we need to do to be our own cheerleaders. Okay. And then we have radical acceptance. So radical acceptance is, first I'm going to talk about pain and suffering from that graphic. So pain is an inevitable part of life, and I think most of us would agree, right? Emotional pain is inevitable because terrible things happen. If we can accept pain and accept that pain is a part of life, that's radical acceptance. That's what's going to reduce the intensity of our emotions. If we are rejecting that pain is a part of life, if we refuse to accept pain, we turn that pain into suffering, right? So we want to reduce suffering. We also want to reduce impulsivity. So often the things we need to accept are things that are in the past. They've already happened and we can't change them, or things that are outside of our control. And so again, wise mind to figure out what is within my control and what is outside of my control. We're doing this all the way, right? This is not something you can sort of half-ass. You have to do radical acceptance all the way. Oh, the serenity prayer. I'm so glad you said that. Yes, a lot of people equate radical acceptance to the serenity prayer, right on the money, right? Acknowledging what we can and cannot change, knowing the difference. I love that. I love that you mentioned that. So, you know, for instance, let's say I am exercising and I get a physical injury. Let's say I, you know, hurt my knee, right? I can go to the doctor, right? Or I can continue to like hobble around and make it worse, maybe to the point of where I need surgery or I need a boot and crutches, right? That's an option. I can reject reality, or I can go to the doctor, right? I can tell myself this is what I have to do to feel better, right? I can retrain my thoughts, which is going to help with my emotions, reduce my suffering, right? Go to the doctor, ice my knee, stop walking to work. So it's also important to note that radical acceptance is not approval. We can radically accept horrible things in this world. Acceptance means that this is happening and I cannot change it. And by denying it, or rejecting it, I'm going to make things worse. Okay, really quickly, this is our last group of skills for the day. I know we went through this really quickly, but these are some other acceptance-based skills for situations we cannot change. So I love this graphic because often we do come to a fork in the road in difficult circumstances where we have the opportunity to either accept and go down what we call reality road, or we can go down like rejecting reality road, right? We've got two options. And willingness is going down reality road and accepting that, you know, reality is as it is, and we do what's needed to be effective. A way to help ourselves do this is by using what we call willing hands and a half smile. Now, these can be done individually. They can also be done together. So I want to quickly show you what that is. If everyone can just put their hands on your legs, down in your lap. And then I want you to flip and turn your palms upwards towards the ceiling. This is a way to let go of some of that tension in our bodies when we're fighting reality and bring our emotions down. At the same time, another thing you can do is called half smiling. So that means I want you to maintain your neutral resting face and then gently turn up the corners of your mouth into a half smile. It might feel uncomfortable if you've never done this. I promise it does not look weird to others. The benefit of masks is people can't see we're doing it, but this really should look like an authentic, pleasant resting face. And by changing our body in that way, physically, we can trick our thoughts and our emotions towards acceptance as well. And turning the mind is just reminding ourselves again and again of what we need to accept, essentially, in one sentence. Can we get the next slide? Okay, so these are just references for the books I showed pictures of. And then on the next page, I've got some links to some reputable sources if you're interested in learning more about DBT. And yeah, happy to take any questions in the few minutes we have left. So you can feel free to email me if you have any additional questions about DBT. That is the link as well for my practice, Behavioral Psych Studio. I'm happy to provide additional information. You can reach out. And yeah, thank you so much for having me.